Thank you, Chairman, and good afternoon. Today, there are a total of 41 additional cases of confirmed COVID-19 in the community. And I want to kind of give a little background on this because 21 of those were generated through point-of-care rapid testing that was announced by Physicians Immediate Care. And some of those results have been sitting for almost 10-day lag in reporting. So understand that half of those now represent a lag. The ages ranged from 5 years to 65 years. So there is no sparing of any particular age group. Fortunately, no additional deaths were confirmed. We're still standing at 14 total confirmed. And we're reporting a total of 3 additional cases being reported from the Rochelle Hormel facility, bringing our total to 6 in Winnebago County. On the positive side, 28 individuals have been reported as recovering, representing 7.9 or almost 8% so far of our individuals who have tested positive now are reported as recovering. But I want to really kind of talk to you about as we ramp up testing sites. So the community-based Triple T site that we've been calling it, the test, triage, and transfer site in the first 3 days of operation has tested over 861 residents, of which 75% came from Winnebago County. So again, our population is understanding the importance of getting tested and coming out. But I want to remind everyone, the site is at the University of Illinois College of Health Sciences campus at 1601 Parkview. It's open from 8 a.m. to 4 p.m., 7 days per week. So even if you have a job with odd hours or essential service position that you need to come, they are open 7 days a week. They are allocated 500 tests per day. It's a self-administered nasal swab for symptomatic. We've talked about that before. Why? Because it's going to be in the lower portion of the nasal nares. No immigration questions are being asked, and there is no cost to the public. So that is one opportunity. Crusader Community Health opened its site today, beginning at 9 a.m. The site is at Auburn High School. Drive-up and walk-ups are welcome at that site. They're open from 9 to 4:30, Monday through Friday. They're doing the nasopharyngeal swab, so meaning they're going to go a little bit deeper on that test, and so they are also going to be focused on individuals who are not having symptoms. No immigration questions are being asked, and again, there is no cost to the public. So within our community, there are 2 opportunities to get walk-up or drive-up testing. And please, if you're an individual with symptoms, please use our College of Medicine location on Parkview. If you're asymptomatic and a healthcare worker, the nasopharyngeal is the better site for you at the Crusader Community Clinic. But we've been talking about this. As testing increases, we expect the number of positive tests to increase. But I really want to stay focused on the percent that are positive. Several weeks back, we talked about the number of positive tests increasing, and the percent positive was under 10%. Today, the percent positive, meaning of all the tests that come back and are resulted, approximately 17% indicate have confirmation of COVID-19. So we really need to understand that as our numbers increase, we're also going to be watching at that positive. As we move through, we've also identified some zip codes, and we're going to call those communities of concern, where the disease burden has really had an impact greater than other areas of our county. And we've today announced that we have a strike force team that's going to be looking at that and looking at ways that they can improve by education, outreach, concern around testing, as well as encouraging our at-risk populations to continue to get treatment for their underlying conditions. As the chairman said, this is not the time to give up on managing your diabetes, your hypertension, your kidney disease. You need to be managing this while preventing transmission of COVID-19. We've also had some indications from our hospital partners. Please don't delay emergency department care. If you have signs and symptoms of a heart attack, asthma, if you have renal disease, if you have signs and symptoms of stroke, please do not delay treatment. Call 911. They are there for emergency services, and they want to bring you in as quickly as possible. And they are able to care for you in both a COVID-positive environment and a COVID-negative environment. But do not delay medical care and treatment. So as the strike force gets together, they're going to really be focusing on prevention education. What can you do in those community areas? How can we help you if you have a positive member in your family or community? How can we help get them the care that they need? testing using one of our locations and test, as well as support. We understand that when you're in a household of 6 living in a 2-bedroom, isolating yourself may not be possible. So what can we do to help you support that? As well as referrals. On Saturday, in the pop-up food pantry, over 1,200 households were served with over 62,000 pounds of food being distributed. We know the need is there. So while you're in those community areas and while we look at the increasing infection rate, we want you to know that we're there to support and get you through this. We want you to take care of your chronic medical conditions. We want to make referrals for appropriate financial support and other health care kinds of needs so that when we come out of COVID, we are not kind of pushing back on our social determinants. We're pushing forward. Again, the reminder is healthcare is an essential service. Nothing is changing on May 1st about the definition of healthcare being an essential service. And so we need you to be managing those. And do not delay care or treatment. We identified one location of concern over the weekend as being reported yesterday at Winnebago County Jail. It was a case in a new inmate, and you'll hear more about that was promptly identified by the University of Illinois medical team and the Winnebago County Sheriff Correction staff, who took the appropriate action to promptly isolate the individual and quarantine close contacts. But I want to reassure you that was a response that had been planned for and prepared for. Their protocols and their policies and procedures that they had put in place were very stringent and quickly identified, and were able to then manage the situation as it arose. So I'm going to turn it over now to Sheriff Caruana to have him provide some additional detail on the location of concern. Sheriff?
Thank you, Chairman, Dr. Martell, Mayor, for all the hard work you've been doing these past several weeks. As the doctor explained, that we had our first positive COVID-19 in the jail discovered yesterday in the jail. Here's the background and the scenario on that. It's a male who is 40 years old. That inmate came in on the 30th of March on a domestic battery and a Department of Corrections parole violation. And he was immediately isolated and took the screening, that we have a questionnaire screening test, and right away we check everybody's temperature. So he was had no symptoms, had no temperature, and the screening went well. He was isolated, and on April the 9th, he was given a physical with that's in the guidelines of the DOC, Department of Corrections guidelines for the physical, and he was negative as far as any symptoms, showed no symptoms. The physical was positive. Again, on the 22nd of April, he was also given a screening and a physical, and he again showed no symptoms. On the 23rd of April, he complained of a sore throat. Right away, he was isolated, and he was given the testing, COVID-19 testing. On the 26th, yesterday, came back that he was positive. That individual is being treated by the UIC daily, and at this time there is no symptoms at all with this inmate, no sore throat and no other symptoms. For further medical precautions, what we're doing is he was involved with a pod of 27 inmates, so they are at the time all isolated, and they are being tested 3 times a day by UIC to make sure that they don't exhibit any symptoms. As of this point, there are no symptoms being recognized. All inmates are wearing on a daily basis surgical masks, and when they're in or out of the pod. Our officers are also wearing N95 masks when they report to work, and when they do report to work, they are all given their temperatures taken. And if they feel sick or feel like they have any symptoms, we ask them to stay home or go home right away. As far as further precautions in the facility, we clean 3 times a day, morning, noon, and night. We had an outside agency come in and sterilize the whole Justice Center from the basement all the way to the jail top floor. All inmates are provided with supplies, cleaning supplies, and soap. And also we are limiting the amount of inmates in any pod at this time to provide as much distance as we can in that environment. And then again, if there's any symptoms, we again isolate them and notify the health department and the UIC. Thank you.